heel and lace pads. A little bit of skin lube, which decreases friction, prevents tape cuts, etc. Again, you hold the ankle in the anatomical position, which looks like a 90-degree angle, but anatomically it's what? 0. So 1 over the laces, protecting. She's got a good tibialis anterior, extensor hallucis longus, extensor digitorum longus, and what you really can't see is peroneal tertius coming from the distal anterior surface of the fibula down to the base of the fib. And obviously, heel protects the Achilles tendon. So pretend that's on. Then we would use a little bit of pre-wrap to hold the ankle wrap, to hold the heel and lace pads in place. So usually I go, catch the bottom half of the ankle brace, heel and lace pad, I'm going to go across the top, over the heel, and tear it. I'm always going to tape, if she's going to go to practice, I'm going to tape on skin because you get much greater support. If, however, she just sprained her ankle, and I'm going to treat her for first aid principles of compression, ice, elevation, crutches, etc., she's going to keep the tape on 24/7. And if you keep the tape on her skin for more than just a few hours, when you take it off, there's a greater chance of getting a tape cut. If you get a tape cut, then that's painful, chance of infection, on and on and on. So is the skin more tough on the lateral side or the medial side of your leg?
Lateral.
Medial. Your skin is definitely thinner, more tender on the medial. Volar surface, ventral surface, the dorsal surface of your back, which is thicker. Dorsal is much thicker. You won't believe if you take a cadaver anatomy course, when they skin your cadaver to get down to the first layer of muscle, how thick that is. Just ask that guy from the Silence of the Lambs, right? So the athletes. So if we're going to tape overnight, we're going to put no tape on skin. So I'm going to bring the pre-wrap all the way up from the base of the toes, all the way up to like mid-lower leg. But then if I taped her leg like this for practice, I liken this to taping over top of a sock. Because when I'm all done, again, when you're taping around, what's the geometric shape of the lower leg? Cone shape? Cone. It's impossible to bring the tape straight around the leg evenly. You'll get a wrinkle every time. You have to angle down slightly, and after a while you just look at the person's leg and you'll know how much of an angle to make. So if I let tape her whole leg, I could do this. Is that giving you a whole lot of support? Certainly not. So for practice, we wouldn't do that. For an overnight taping as a first aid principle, we would put no tape on skin. Okay, so this is the basic pattern. The first thing I'm going to do is a vertical stirrup. So I'm going to measure the non-sticky side against her leg, take it away. I tell the athletic training students they have to keep the tape in their hand. They can't put it down, pick it up, drops off, and they're rolling around on the floor trying to find it. If you guys put it down, I'm not going to yell at you. But if it's a student trainer, I would yell at them. After a while, it's like having a ring on your finger. You don't even know it's there. So the first purpose of the vertical stirrups is to push the calcaneus, and more importantly, the talus, right, up into the mortise to give good bone-to-bone contact, thus greater stability. So I'm going to forcefully push these strips up the long axis. So I'm going to measure 1/4 inch from the back of the heel, bottom of the heel. I'm going to bend over and I'm going to look. Push forcefully, let go with my fingers, with my palms, smooth the tape on. I'm going to overlap that by half the width, second time. And now I'm going to overlap half the width. Push. Let go of my fingertips with my palms. Smooth. Get onto her leg. That's the first step. Second is a series of what I call horizontal circles, just a little bit above the malleolus. Since I'm right-handed, I like to go to the right. And this is easily go to the left. It doesn't really matter. But you have to angle the tape. And I like to tear it so my seams are kind of in the back, so it looks neater. If they turned around, you should see my seam, but overlap these by half the width. And I'm going to do enough horizontal circles till I close my verticals. So I don't see my verticals. So I'm going to do one more. I'm going to try to bring this last one as close as possible to a point. The purpose of the horizontal circles, two things. It holds the fibula and the tibia together, thus holding the mortise together. And then the second purpose, whenever you sprain your ankle, invariably you strain some of the muscles in the different compartments of the lower leg. So it's supporting the soft tissue musculature. Two reasons. So if I ask you on a quiz or exam one, what's the purpose of the horizontal circles? I'm looking for two answers. Holds the tibia and the fibula together and supports the muscles of the lower leg. Okay, the third step is horizontal horseshoes. So halfway between the toe and the heel, I'm going to go as low as possible to the bottom of the foot, back, behind, and halfway up on the other side. And I'm going to overlap these half the width as I go up toward my horizontal circles. And the purpose of the horizontal horseshoes, it just supports the ankle joint. And I'm going to do enough to overlap my most distal horizontal circle. And then I've gotten in a habit over the years, but the athlete doesn't even know I'm doing this. I just kind of go like that to feel for uniform pressure. And so it doesn't feel like tight, kind of a soft spot, and it's tight again. So that just reinforces. With a little bit of practice, your ankles should look like that. Now comes the hard part, the double figure eight. So, you know the pattern. You don't have to anchor it because the tape is sticky, right? But from my perspective, I'm going to go back. As I go back, I'm going to angle down just a little bit behind Achilles tendon, down on the opposite side, underneath, and up. As soon as you get here, you have to turn and go right over the lateral malleolus. If you go above, when you come down on this side, you're going to get wrinkles every time. So if you have a wrinkle, either lateral or medial, that means you did something on the wrong side, opposite side of the ankle. So I'm going to make my turn, and I can play around with it if I keep the pressure on. So I'm going back. People on this side can see I've angled down just a little bit behind, down on the opposite side, underneath and up. So I've done one double figure eight. I'm going to repeat that. So back, behind, down on the opposite side, underneath, up, make my turn, right over the lateral malleolus, back, behind, down on the opposite side, underneath, and up. And then I'm going to do what I call a heel lock. If you ask 10 athletic trainers what a heel lock is, you're going to get 10 different answers. My definition of the heel lock is I'm going to put this last piece of tape, a 45-degree piece of tape, right over the heel, kind of lock the heel in, pull it up, come around, tear it off. I'm going to put a little tab so it's going to be easy to find the end. And then the last thing we do is close off the forefoot. So if you've ever had your ankle taped, you know the most common place to make it too tight is right at the base of the fifth metatarsal. Again, she's non-weight bearing now, right? So if it's too tight, like this, she steps down, what's going to happen to her foot? It's going to spread out, right? Because of the weight bearing. So you have to just lay the tape on gently, and I'm going to pull up medial. By pulling up medial, I'm giving added support to the medial longitudinal arch. It would not make any sense to me to ever put the tape on and pull down on the arch. Right? That just would not make sense. And so, that's another question I would ask. When taping around the forefoot, in which direction do you pull the tape and why? You go lateral to medial, pulling up, medial to give added support to the medial longitudinal arch. And that's it. Now, to take it off, excuse me just one second, back up a little bit. We would give the person, after 2 hours of practice, the tape loosens up a little bit. Usually you make a small indentation right here and kind of go right down behind the medial malleolus, and it comes right off because there's a blade right there. But to try to do that now, when it hasn't loosened up, I'd make an enemy for life. Right? So it's better to take it off one piece at a time. Now, if I were taping for an overnight taping, I would cut, besides putting pre-wrap from her toes to mid-leg, no tape on skin, I would, and most ankle sprains are inversion ankle sprains, right, where you stress the lateral ligaments. So I'm going to cut a horseshoe pad that goes around the lateral malleolus. And depending on how high the pain goes up between the fibula and the tibia, if it's a high ankle sprain, I would make these longer. But it blends in, and this is a little bit bigger because she's got a small ankle foot, and you pre-wrap that into your taping before you began. And then you tell the athlete the next day when she comes in, you cut the tape off, throw it away, save the felt. Right? Because making new pads, that's more money out of your budget. Okay, so the rest of the time is your time.